Fall 2007, somewhere in the American Southwest. A 54-year-old man named John finished a week-long hiking trip through the Red Rock Canyons of Arizona and New Mexico. He was fit and active. But something happened on that trip. Something small. Something he did not notice. A brush against tall grass. A moment in the wilderness that seemed insignificant. Within weeks, John's left knee began to swell. He assumed it was nothing, just a twist from the trail. Maybe he stepped wrong on a rocky descent. These things happen to hikers all the time. He was wrong. 14 months, 5 specialists, 2 surgeries, and 1 cancer scare later, John still did not have an answer. His doctors were out of ideas. His leg was in agony. Amputation was now on the table. This is the story of a medical mystery that nearly cost a man his leg, and the simple question that finally solved it. At first, it seemed like nothing serious. John noticed the swelling a few days after returning from his hike. His left knee was puffy, warm to the touch, and a little stiff in the mornings. He iced it. He took some ibuprofen. He waited for it to heal on its own. But instead of improving, it got worse. The pain became, in John's words, ridiculous. His knee grew so hot and inflamed he could barely walk. The joint would swell until it was almost unrecognizable. He started using a cane just to get around his own house. His wife watched helplessly as her active husband struggled to climb a single flight of stairs. His first stop, an orthopedic specialist. The diagnosis? Probably a torn ligament or cartilage. Classic sports injury. An MRI was ordered. John felt relieved. A torn ligament was fixable. He would be back on the tennis court in a few months. The results came back. Normal. No obvious tear. No structural damage. Nothing that explained the relentless swelling. Physical therapy was prescribed. Cortisone shots were injected directly into the joint. Nothing worked. If anything, the knee seemed angrier after each treatment. Another doctor suggested gout, a type of arthritis caused by uric acid crystals. But John had no history of it. Tests came back negative. By late 2007, John was desperate. He had tried everything. Rest, ice, medication, therapy. He agreed to exploratory surgery. Maybe the doctors would find something the scans had missed. Surgeons opened his knee and found only a small cartilage tear. Nothing that would explain his symptoms. They repaired it anyway and told him he would recover soon. He did not. Months passed. The pain returned, worse than before. Walking became torture. John went from using a cane to needing a walker. His world shrank to the distance between his bed and the bathroom. A second MRI revealed something disturbing: abnormal tissue growth around the joint. Dark masses that did not belong. Doctors now suspected a rare condition called pigmented villonodular synovitis. John underwent a second surgery. What surgeons found made them exchange worried glances across the operating table. Strange, aggressive-looking tissue. They feared it might be sarcoma. Cancer. A specialist sat John and his wife down and delivered the worst-case scenario. If the biopsy confirmed cancer, they might have to amputate his leg to save his life. John's wife broke down. John sat in stunned silence. A hiking trip, a swollen knee, and now he might lose his leg. Biopsies were rushed to the lab. John and his wife waited in agonizing silence for days that felt like weeks. The results came back. Negative. No cancer. Relief flooded through them, but it was short-lived. If it was not an injury, if it was not gout, if it was not a rare tissue disorder, and if it was not cancer, what was destroying John's knee? An infectious disease specialist entered the case. Fresh eyes, a different approach. He reviewed John's entire medical history and noticed something the others had overlooked. John's hiking trip, the desert soil, the Southwest wilderness. The doctor became convinced, 95% certain, that John had contracted valley fever. Valley fever is a fungal infection found in southwestern soil. Breathe in microscopic spores, and the fungus can spread through your body, settling in your joints. Finally, an answer that made sense. John was started on aggressive antifungal medication, but the drugs made him weak, nauseous, and he could not eat. And his knee was no better, not even slightly. Lab tests confirmed what John feared. Valley fever was not the cause either. Another dead end, another wrong answer, 5 specialists, 2 surgeries, 0 answers. Then, during a hospital staff meeting to review John's puzzling case, someone spoke up. Not a surgeon, not a specialist, not someone with decades of training. A nurse. She raised her hand and asked a simple question. Has he ever been tested for Lyme disease? The room went quiet. The specialists looked at each other. They flipped through the thick file of test results. Incredibly, through 14 months of consultations, scans, and surgeries, no one had ever tested John for Lyme disease. No blood test, no joint fluid analysis, nothing. It had simply never occurred to anyone. John did not even have to leave the building. He took an elevator down to the lab and gave a blood sample. Then he waited. The results came back unequivocal. John tested strongly, positive for Lyme disease. The antibody levels were off the charts. He had been infected for many months. All along, a stealthy bacterial infection had been the unseen enemy, slowly destroying his knee from the inside while doctors chased phantoms. Lyme disease is caused by Borrelia burgdorferi, a spiral-shaped bacterium transmitted through the bite of an infected tick. A tick so small, you might never notice attached to your skin. Most people know about the early symptoms, the bullseye rash, flu-like fatigue, and fever. But here is what many do not know, including John's specialists. If Lyme disease is not treated early, the bacteria can go dormant, hiding in the body for weeks or even months, silently multiplying. Then it resurfaces, and one of its favorite targets? The knee. This late-stage complication is called Lyme arthritis. It causes severe swelling, heat, and pain, typically in a single large joint. Exactly what John had experienced. In hindsight, it made perfect sense. But John's doctors had been so focused on orthopedic injuries and rare diseases, they never considered a simple tick bite. A Lyme specialist later confirmed that a routine blood test early on would have revealed the infection immediately. Instead, John spent over a year chasing phantoms, while the real enemy hid in plain sight. With the true diagnosis finally in hand, John began treatment. Doxycycline, a common antibiotic, is the standard treatment for Lyme disease. No surgery is required, just a simple pill taken twice a day. After several weeks on the medication, John's condition began to improve. The swelling went down, the heat faded, the pain eased. Slowly, he regained mobility. He abandoned the walker, then the cane. John eventually returned to the tennis court, something unimaginable during his darkest months. His knee never fully recovered, some stiffness remained, but the nightmare was over. All that was needed was a simple blood test. So many specialists, and none of them could see what was right in front of them. In the end, it was not a surgeon or specialist who cracked the case. It was a nurse, asking the question everyone else had overlooked. So, could this happen to you? Lyme disease is most common in the northeastern United States, the upper Midwest, and parts of the Pacific coast. But cases have been reported in all 50 states, and in Europe, Asia, and beyond. Here's what to watch for. A bullseye-shaped rash, though not everyone gets one. Flu-like symptoms, including fever, fatigue, and headaches. Joint pain, especially in the knees, often affecting just one side. Neurological symptoms, such as numbness, facial drooping, or memory issues. If you have spent time outdoors where ticks are common, hiking, camping, or gardening, and you develop unexplained joint pain weeks or months later, ask your doctor about Lyme disease. Do not assume they have already considered it. Request the test yourself if you have to. A simple blood test could save you months of misdiagnosis or worse. Prevention is simple. Check for ticks after outdoor activities. Remove them promptly. Wear protective clothing in wooded areas. John's story ended well, but it almost did not. 14 months, 5 specialists, 2 surgeries, 1 simple question. Sometimes the smallest observation can unmask the hidden enemy. If this story made you think twice, subscribe for more medical mysteries that could save your life or someone you love.